Hello, everybody. For those of you who don't know me, I'm Ross McClellan. I'm the President of ARMS and the Director of the Office for Research at Griffith University. First, I'd like to acknowledge the traditional custodians of the land on which we are all sitting whilst we join this meeting, and to pay my respects to their elders past, present and emerging, and I extend that respect to all First Nations peoples. Everybody, welcome to this special instalment of the ARMS PD at Zoom series. These are clearly unusual and concerning times, and I hope that you and your loved ones are well, that you're safe, and that you have the necessary supports available to you to help navigate the coming weeks. And during these periods of uncertainty, such as those posed by this current pandemic, there is, I believe, an increased importance in maintaining engagement with our peers in both the research and the research management communities. And as such, ARMS, like many organisations, including your own, is examining alternative methods of delivering our entire range of services, whilst importantly ensuring that the quality of benefits is maintained. And to this end, as you would imagine, we're working closely with a range of stakeholders, including, importantly, many of you, our members, excuse me, to continue to provide the networking, learning and professional development opportunities that are going to benefit you through this difficult period. But in addition, and let's be clear about this, this isn't a simple transition to working remotely. That would be far too easy for the group which are joining this call today. We are all living through a crisis, and I'm sure Nicholas will pick up on this, where work, education, daily life have all been disrupted, and where we're all concerned about the health and the mental health of our families, our friends, our colleagues and of ourselves, whilst we try to continue to deliver work at our usual high standard. And it's really this backdrop, or with this backdrop, that I'm delighted to be introducing today's incredibly relevant and important session delivered by Professor Nicholas Procter. Nicholas is someone I've had the privilege of working with for a number of years. He is the chair of mental health nursing and the leader of the University of South Australia's Mental Health and Suicide Prevention Research Group. As you will have seen from his bio, which was part of the invitation to this webinar, he has a long-standing research and clinical interest in the impact of trauma and uncertainty upon people's lives, mental health practice, and has published widely on these topics. Nicholas is representative on a number of national and international bodies. I won't even try to run through them all now, but just to flag that he is Australia's national representative to the International Association for Suicide Prevention, and a member of the expert advisory group to the Prime Minister's National Suicide Prevention Advisor and the National Suicide Prevention Task Force. And I'm really looking forward to what he has to share with us today. Before handing over to Nicholas, as I'm sure you will have found already, with the amount of time that we spend using virtual communication technologies, Zoom has a Q&A function. I'd ask you to pose any questions to Nicholas through that, and he will have the opportunity to address those at the end of his presentation. So without any further ado, Nicholas, the virtual floor is all yours.
Ross, thank you very much. And I'd like to welcome each and every one of you to this webinar. I'd also like to acknowledge the excellent support and facilitation from ARMS and the ARMS team, Dana, Maria and Ross, in making today happen. I feel very supported and very engaged throughout this process. I'd like to welcome all of my nursing colleagues that may be online right now, and certainly my colleagues at UniSA. And for those UniSA colleagues will be aware that we've transitioned to a new structure, and I belong to UniSA Clinical and Health Sciences, and I'm extremely happy about that, and very proud to be speaking to you today as a UniSA Clinical and Health Sciences person. So what I'm planning to do today is really talk about, I guess, 4 key areas. And so I've structured my talk across 4 key areas. And if you like, it's going to start off with a bit of an explainer about my thinking and my conceptualization of COVID-19 and what it's done for what we say, do, think and feel, and what that means, not just for the research community. And Ross is quite right in talking about how we have to be nimble and flexible in terms of data collection, or even in some cases pushing the pause button on data. But I'm going to work my way up really to talking about trauma, and the biggest body of work that we do at the University of South Australia is with people who have a mental health condition, their carers, their loved ones, working with them and looking at systems change. We've also done a lot of work around uncertainty and the way in which a big dose of uncertainty can really rock somebody's mental health and what that means for trauma-informed thinking. So across Australia right now, our National Mental Health and Suicide Prevention Strategy and the Fifth National Mental Health and Suicide Prevention Plan, absolutely headline trauma-informed approaches. So I am going to touch on those and give some explainers, some real concrete explainers as to how they can possibly play out in a COVID-19 world. I'm also going to take you into a little bit of brain functioning, and I'm going to talk a bit about getting a balance between our emotional brain and our thinking brain. And COVID-19 has been triggering for a lot of people, and for some people it's been a crisis, and that may be because of past experiences of trauma, restrictive practice, or being in held detention. And then finally, I'm going to spend some time just talking about working from home. So the good people at ARMS have asked me to spend a few moments just reflecting on some tips and trying to get a sense of normality working from home. So plenty of lived experience for myself, and no doubt lots of lived experience for people who are watching today's presentation. So there's no question that COVID-19 represents a hostile takeover. It's a hostile takeover of our lives, and it's a hostile disruption to our core business as researchers, as parents, as employees, as citizens. And it's triggered for a good many people fear and uncertainty, and certainly a sense of danger. The invisibility of COVID-19 and the virus and how it might survive on various surfaces can be very triggering. And what I like to say in situations like this is it can trigger flash forwards in our minds. It can trigger flash forwards about what might happen, what are some contingencies. Earlier today, I was talking to somebody in our South Australian Mental Health Commission about how the Commission was managing COVID-19, and the person I was speaking to said, look, normally when my husband gets a sore throat, there's nothing to it. But today he had a sore throat and he's completely strung out by having a sore throat and what that might possibly mean. But in a COVID-19 world, we're also dealing with information that's constant. And my point about that, it's part of the human condition to feel overwhelmed by the information that we're currently receiving. I'm going to speak a lot more about that, and I'm going to talk about ways in which we might be able to calibrate the information that we do receive and why it's important to focus just on one or two trusted sources. So when our nervous system is overwhelmed by stress, it sets off a range of powerful thoughts and emotions. And that's the kind of uncertainty that is particularly dangerous. But what I will say to you is that this particular virus exploits what humans do really well. This particular virus requires humans to act in ways that are natural for humans to act. In other words, as humans, we're wired up together to come into close proximity with each other. We're wired up to be with other people. It's part of our lives to work in teams, to embrace, to handshake, to show outward signs of affection. And that's exactly what this virus exploits. So that's another level of disruption to the disruptions that we are well aware of. So this is a contagious and dangerous virus that exploits the naturally occurring pathways through which we as human beings love to live our lives doing. We love to live our lives doing these things. And when this virus takes advantage of our natural human instincts to threaten us, to prevent us from living a flourishing life, to be close friends with other people, to be with our family, to have family gatherings, to be with our work colleagues, it also threatens to kill us. And that is what is so clearly most devastating and powerful in terms of the potential for this virus. And yesterday in the Parliament, there was a real example of how this virus triggers the danger by exploiting the very things that humans do well. Now, some of you may have seen this on the ABC News last night, and it certainly ran on Channel 9. What happened, and it was a very brief moment, Josh Frydenberg finished a media conference in the Parliament, sitting day yesterday, as you know, and Anthony Albanese approached him just as he was breaking up his media conference. So really most cameras had stopped rolling. And as a natural human reaction, he went to shake hands, but was rightly reminded by Albo, and that's on the footage that ran on the TV news last night. I thought this was a great tweet and worth sharing with you today because it goes to the heart of this very important point of how we are wired up, how our central nervous system, through evolutionary processes, is wired up to behave without even thinking, which it makes it very, very easy for this virus to transmit itself. But the point there, it's a habit to break, but an important reminder of social distancing. Now, my personal preference for social, as a substitute word to social distancing, is actually physical distancing, but I'm not going to worry too much about that today. But this is a really important exemplar, real-world exemplar, in the way in which we have to change, and we are changing and going against the grain of who we are and the way that we flourish. And those things that change us, those fears and emotions, for some people who have past experience of war and conflict and detention, the experience of this pandemic can be quite triggering and re-triggering. And I noticed in the advertising for today's webinar, ARMS did circulate an interview that I did do for SBS Radio. It goes for around 6 minutes, which included some people who had war exposure in Syria and had experienced held immigration detention in Australia. And the way in which pandemic was re-triggering for them, particularly the footage of seeing people rush to supermarkets to buy possessions, cleaning out shelves, not having things to be able to provide for their family. The triggering nature of that, the re-traumatizing effect, and the activation of stress and all sorts of stress responses, not sleeping, inability to concentrate, feeling irritable, easily startled, the way in which that triggered, if you like, a post-trauma stress response for those people. But we also know for people that reactions and emotions can and will vary. So there may be times when things are really clear and we have a sense of direction. We've got compass coordinates that tell us what our true north is, how we're going to function with this particular virus, what it means for our family, what it means for our workplace. But what we're seeing around Australia, and certainly what I'm seeing in the mental health sector, and what we are seeing overseas dramatically as that footage comes through, strong feelings of fear and hopelessness, feeling completely overwhelmed, and feeling edgy, crossed, irritable, detached. And my point about this is the importance of being self-aware and prepared to find these responses in ourselves and in other people. So this is the first kind of gentle connection with the title of today's talk around relational safety, relationship safety and relational safety, because we need to be prepared to find these responses within ourselves and what we see in others, particularly people in our family or even in our colleagues, that they may not be themselves. They may be perhaps different in some way, perhaps more edgy and perhaps more irritable, or perhaps detached and perhaps more dreamlike. But if we can be really conscious and have that in conscious play for ourselves and others, that's an incredibly important aspect of a point that I will be building up to around relational safety. And the motivation for some of these tense emotions and difficult emotions, these triggered responses that stimulus in our environment is particularly threatening comes from some very good and well understood brain structures, particularly our primitive brain, or what sometimes people refer to as our emotional brain. So all of us right now have an emotional brain, and particularly an organ called the amygdala. And thank goodness we do, because we absolutely need that organ, because it's our threat detection center. It's the center of our brain that tells us what to look for when we're driving a motor vehicle, what to look for when we use an ATM machine in a foreign city or a foreign country. It tells us what to look for if we're in the garden and we're moving some bricks from an area where there may be cobwebs. This part of our brain is our 24/7 threat detection center that enables us to detect and interpret stimuli. We need it. It's really handy to have, and we can make very good use of it. But in times like this, in COVID-19 times, it's a part of our brain that becomes more active than at other times. We've got other parts of our brain that can help calibrate that back. And I like to think of that as the thinking brain, the cortex in particular, and the prefrontal cortex comes to mind. So there's some really important brain science happening for us right now in COVID-19 times, as there is good brain science in all other times that we are alive and functioning and doing the things that we do in our normal lives as a dad, a mum, a parent, a husband, a wife, a child, whatever we may be. But this amygdala is the real control center, the fear detection center in the brain. And it's the engine room for threat-related attention bias. So it's got a really important job to do. And as I said, in normal circumstances, it does that job very well. But in COVID-19 times, it's constantly retelling us and reminding us to question everything that we do. Is this going to be a threat? So if I shake hands with Albo, is that going to be a threat? If I touch that, if I go to the supermarket, if I'm near somebody who's coughing, if I'm not 1.5 meters away from somebody, you know, if I'm walking in the park, whatever that may be, I'm suddenly having to kick in with these automatic threat responses, and it activates our survival mode. And I think there's a very strong relationship here between the survival mode and the activation of the amygdala in particular, and what we've seen with panic buying and panic behavior and some of the aggression that we've even seen, the fight, flight or freeze type behaviors that we may have seen. And because it does produce fear in us and potentially aggression in some cases. Because when that area is activated, we do feel afraid, reactive and vigilant. And it is part of the human condition to do that. That's exactly what we are designed to do. So this 24/7, always on, better safe than sorry part of who we are is doing its job. And it fires up whether the threat is real or imagined, likely or unlikely. And my point about that is that it can be very difficult to think straight in a crisis. It can be very difficult to problem solve in a crisis. It can be very difficult to make decisions in a crisis. And that's why in a COVID-19 world, my essential argument, thesis here, in a COVID-19 world, we need to keep our emotional brain and our thinking brain in good sync. And we need to do that by seeking out trustworthy information, trustworthy people, and reciprocal human connections are essential to that. At a time when the virus exploits those exact things that we need to calibrate, to calm, to meditate, and to be with other people. And this is a really important foundation, I hope, is making sense to you on this webinar today. And there are parts of the brain that are really geared up to do this. The ACC, or the Emotional Regulation Center, is located in the front part of our brain and has a close relationship to the thinking center of our brain. So I'm now moving away from the emotional brain and I'm going to spend a few minutes talking about the thinking brain. So when this region is strong, when we're in the zone and when we're connected with this particular region, we can manage difficult thoughts, and we can mitigate ourselves away from being totally overwhelmed, because that emotional brain, if you like, wants to have a hostile takeover of our thinking brain. And a hostile takeover of our thinking brain is all about emotions: fight, flight, freeze. I want to give you an example of someone that I saw this week. This is a midwife, practicing midwife, who was in a very distressed state. So I'm talking about somebody who was very anxious, couldn't sit still, really quite agitated, and wanting to make an angry call to her employer because she was furious about not being paid for an extra shift, not having a sick leave documented on her payslip. So this is a practicing midwife in a public hospital, large public hospital, and there were people near her, I was near her, and we could see what was unfolding. And this midwife, in helping to calm her and helping to think about this, we broke down into small bits, if you like. What was the problem around the sick leave? What was the problem about what may be an error, what may have been an error on her pay slip? And then just taking her time, talking to the pay office about what she thought was a problem. When we worked through this, this midwife never worked an extra shift. When she realised that she was able to think straight, it turned out that this midwife is a practicing midwife in a COVID-19 clinic where pregnant women are receiving assessment and treatment for COVID-19. This is a midwife wearing PPE, and this is also a midwife who has been very conscious about social media. This is a midwife who watched the story unfold of a midwife in the United Kingdom of a similar age to her, who passed away, died of COVID-19 just hours before she started her shift. This midwife didn't work an extra shift. She was desperately worried about getting sick from COVID-19 and not having enough sick leave to cover her sick leave. And she was so overwhelmed, and her thought processes and her thinking processes were completely overwhelming for her, and she was wrong. So this takes us to a place where we need to think about what an active thinking brain can benefit from. And fundamentally, this next series of slides is really a collapsing down of lots of expert opinion. So in the tragedy of COVID-19, we've seen a lot of great resources, great thinkers, great researchers, fast-tracked publications, some great science coming through. It's very difficult to keep up with everything. But we do know that there are some things that are sort of uniformly accepted and potentially very beneficial for people. And certainly, I've been talking to employer groups this week through Business SA. I'm sort of similar things around Australia. People who have had to shut down businesses, people who have had to let people go, people who have had to go into significant financial difficulty, knowing what your entitlements are. If you're impacted by COVID-19, knowing what your healthcare and work entitlements are and what assistance is available and how to access it. And there's been an explosion of great assistance, certainly from the federal government, the relaxed Medicare arrangements, and a range of other resources. We've got 24-hour helplines, the COVID 24-hour helpline. But these things I'll come to as later as well. These things can be extremely good for accurate information and advice. But talking to people and family that you trust and letting people know what's going on for you. So if people are overwhelmed, if people are very troubled by what's happening for them in a COVID-19 world, asking for help is really important. And I'm sure most people on the Zoom right now will be familiar with an organisation called Are You OK? So Are You OK? We have Are You OK Day each year. Well, about an hour ago, the Are You OK Foundation, an international foundation, released a brand new, refreshed version of the Mateship Guide. And the Mateship Guide is a guide of around 7 or 8 pages. And it's about having conversations with people who maybe are not okay. And it's also about having conversations where there may be genuine help offering to support somebody and there's knockbacks. And how do you deal with those knockbacks? The Are You OK Foundation have re-released their mateship guide today in light of pandemic. And our team at UniSA were very pleased to collaborate with the Are You OK Foundation, where we sat down and spoke with people who are impacted by pandemic as well as impacted by the recent Australian bushfires. So that resource is available. It's online from the Are You OK website and foundation. But actively helping and support and accepting help and support from people you care about. And the strong words are about finding people who will listen to you can help a lot. So keeping secrets about how you're feeling is not the way to go. Keeping secrets in itself is very stressful for individuals, for families, and for people having support and empathy that's really considered understanding is incredibly important about retaining your active brain, your thinking brain, and exercising that. But there's exercise in other ways as well. And experts in the area are really making a strong point about exercise as being built into a daily routine. And most people I've spoken with today have had their morning walk and can describe what they were doing and where they walked to be able to do that and what sunsets looked like. But certainly the knowledge of exercise being an important antidote to stress, and there's great science around that. For others, maintaining a regular routine and certainly around eating and sleeping, switching off from devices, incredibly important, particularly when there is this need and there is this ongoing diet, a stream of information around COVID-19. Being mindful about use of alcohol and other drugs and being really aware and following those guidelines, having someone keep you in check if it's something that you indeed are struggling with. Nurturing yourself is a great area for thinking about self-compassion and thinking about the compassion that we might give out to other people, the things that we might do for people that we care about. What I'm talking about here is self-compassion and actually turning that onto ourselves. So doing at least one thing a day that helps you feel really good and it's right for you, that helps you feel calm. As I mentioned, and I'm going to refer to some of these in a moment, there's a great selection of online resources, and teams have assembled their best thinkers and best researchers to come together very quickly to provide support for people to live a flourishing life, or a flourishing life as far as they can during COVID-19 times. But there's some very practical things that people are using and people are recommending, which are up on the screen right now. I won't read them out, but there's certainly things that you could think about as things that will calm you, things that will soothe you, things that will make your situation safer. And we use these techniques and this form of language a lot in the mental health sector. So if I fast track to people in experiencing suicide-related distress, we have safety planning, a safety planning intervention for people in suicide-related distress. This is not a webinar about safety planning, but in safety planning, what we talk about with people are things that will calm you, that will soothe you, that will make your situation safer, things that will distract you. And the idea here is that the more you do things that work for you, that soothe, that calm, that distract, that make your situation safer, the better and more automatic it becomes to be able to do those things. And the pre-thinking about those things, the things that you need to do, pulling away from media, going outside, having a warm bath, doing some gardening, spending time in another room or another location, the more rapid and more freely you're able to do those things, the more accomplished you become. And the more accomplished that you become, the easier it is to be able to switch to those things if your emotional brain takes over. So when you've got your thinking brain, you want to bring your thinking brain back into conscious play. And these are some techniques to bring that thinking brain back. And certainly during a pandemic, calibrating media exposure is critical. And my strong recommendation is to stick to 1 or 2 sources of information to do that. Writing can also be very helpful. And I don't want to emphasize people to be worried too much about spelling and grammar and making it sound fancy. It's about ideas and thoughts and feelings. Writing can be also a very useful way to be able to deal with things or make meaning regarding what's going on, what's happening right now. And what springs to mind straight away is a conversation I've had in the last few days with a person who has an elderly parent in an aged care facility who is very poorly, has a cancer diagnosis, and she's not able to visit. She's not able to be with her mother. She's not able to comfort her and spend time by her side. There are restrictions within this aged care facility that don't enable that to happen. So there's a whole range of things that she's working on, she's putting in practice right now to be able to come as close as possible, if that is indeed possible, but as close as possible to be able to connect, to be able to vent, to be able to share, to be able to offload some of the struggles that this excruciating time is giving her right now. And that's a really important one. Staying with messages that sometimes can be triggering messages. So a moment ago, I talked about triggering messagings and re-triggering of particular brain functions that can be reminders of past experiences and past traumas, for example. These kinds of thoughts can be all-consuming. So in a COVID-19 world, if we are all consumed by the fears and anxieties of what COVID-19 might mean, we come into a place, if you like, of cognitive constriction. We are constricted in our emotions, perception, and logic. And cognitive constriction in emotions, perception, and logic mean that we can shut down to well-meaning others in our household, in our work setting, in other relationships that we may have, and we will not be fully conscious of that. We may not be fully conscious that we seem to have shut down. So that notion, being alert to that notion of thoughts becoming all-consuming is something to be conscious of, because in a COVID-19 world, we're not going to be in control of what happens to us in complete terms. So we've got our physical distancing measures right now, and there's state-to-state variation. There's in fact global variation around the way in which physical distancing is manifest. So the point here, the big takeaway on this slide, is to take note of the things and put into conscious play those things that you can control, and bring into conscious play the things that you can control and work with others as necessary to build on that. And that may be working with some of these great online supports and providers that are around right now to be able to do that. So this is not work that you do alone. This is work that you may well be able to do with others. And keeping a positive mental attitude, very difficult to do, particularly in constricted states. The notion of we're all in this together. There's plenty of tags, all in this together. There's no shortage of those. This will pass, it will pass, and maintaining a hopeful outlook and visualizing what you want, how you want the world to be, and making plans and coming as close to working through what that can look like. And I know in research work, that's something that some of our team have been doing even in the last few days. We have pushed the pause button on some of our projects. Data collection is not possible for the type of work that we do. But there are things that we can begin to plan for. There's ways in which we can work around it, substitution effects, if you like, for work programs in writing, proposal applications, a range of things that scientists and others around Australia are doing right now, but also to flash forward and think about how we might like to do things, because that pause button is in a sense an opportunity to think about knowing how and when to move new ways when the research does recommence. So trauma-informed relational safety is a very important part of what we can do. So this, if we take all of these sorts of ideas and storylines around how we are wired up as humans, we can begin to think about the midwife. We can begin to think about our work colleagues. We can begin to think about what we might need to do with our HDR students to be able to support them. We can begin to think about how we might navigate and negotiate with our funders, new funding agreements or nuances, maintaining the science of what it is that we want to do, but being able to do that. And I've added some words here about stepping people through different things. Step through practical assistance, stepped through problem solving with dignity. There might be students who are thinking about withdrawing or pausing their candidature. There might be academic staff that are struggling with how they might find what are the best substitutions for this pause period in COVID-19. But there might also be, and there certainly will be, substitution effects needed because we can't connect with the people that we care about, and they might be in an aged care facility, they might be in our neighbourhood, they might be immediate family members who no longer live in the household. But the point here is about building trust and relational trust, and genuine care and support for our colleagues and ourselves, and being kind to each other. A lot of people have spoken to me about, look, what do I need to tell my children about COVID-19? What advice, can I start to give my children or think about with my children with COVID-19? I think it's good to really communicate with children about COVID-19 without blaming anyone for it. Not blaming a particular country, a particular group. I think that's a really important message to give young children. I think words like explaining words with age-appropriate language, words like pandemic or virus or social distancing, or my preferred term is physical distancing, but maintaining connections at the same time through these explanations and taking time, helping people locate and use those trust networks if they're family members, locate and use trust networks if they're an international student, maintaining connections with other international students. There's a whole range of things that span the work of arms, that span the work of being a citizen, span the work of being connected with our family. And trauma-informed relational safety during COVID-19 is not unlike trauma-informed relational safety for people who are dealing with trauma, dealing with uncertainty, dealing with very difficult manifestations of mental distress and mental harm brought about by circumstances that they are in. So building trust and portraying a genuine interest in care are really the key headlines here. And so too, these excellent resources. So I'm a very big fan of the Life in Mind organisation. They're based in Newcastle, funded by the Commonwealth Government, and they have done a fantastic job to assemble not just resources for mental health, but they've done a fantastic job to assemble resources that are across the lifespan and across different circumstances. People who are veterans, for example, veterans counselling, and other forms of support and resources. And these headline links that you can see up on the page right now, or 1-800 numbers, are being added to as we speak on an ongoing fashion. But there's a Life in Mind section that I think is really worth checking out. It is the COVID-19 mental health support, plenty of drop-down boxes, plenty of scenarios, which I think are really well considered, practical advice, helping people to know how and when to move in new ways, when traditional ways of working, how we might be wired up to do things, aren't possible, but what are the best alternatives to be able to do that. So I strongly recommend that you check out the Life in Mind website. And I'm really pleased that Beyond Blue have expanded their online forums. So the Prime Minister has certainly made announcements about Beyond Blue funding, and there are constant updates coming from Beyond Blue, one earlier this morning, about the online forum capacity. So online chat, online forums are a great opportunity for people to come together and talk out aloud in real time with others having a moderated chat opportunity to come out aloud and talk in real time with others about what's happening for them, what they're seeing in their workplace, adjustments they're making, troubles and difficulties that they may be experiencing, where they might be able to find the help and support. And I think this is a terrific forum, and I really do encourage people to check this out. And this might be something that you want to refer staff to think about, or family members or neighbours or anybody for that matter. And what I also say is that the relaxing of the Medicare arrangements for general practitioners in particular, and other professions, other disciplines, to be able to do telehealth and phone counselling and phone appointments is absolutely fantastic. So some people are describing that as flipping the clinic. I don't mind that term. I think this is a time to know how and when to move in new ways and to be nimble. But if you are concerned about your mental health or the mental health of a loved one, talk to your doctor. What we say in mental health across the lifespan, the quicker you move on something that's troubling you, the more options you have to be able to navigate, mitigate, and take remedy for whatever it is that's troubling you. And, you know, feeling anxious and depressed, having difficulty sleeping, you know, you're noticing in your loved one or yourself an increasing use of alcohol, prescription or non-prescription drugs. These are all good reasons to talk to somebody, talk to your health worker, practitioner, talk to your GP, because these are times that can place us on emotional stress. And part of your package of what comes next after that consultation, that discussion, that reaching out, part of the package of what comes next may well embrace some of the things that I've touched on and the many other excellent supports and services that are available right now. I do have a short film of an interview with Channel 9 News, but I'm not going to show it. It will be available for people, and I'm sure my PowerPoint will be made available for people. It really just fleshes out and expands on some of these points that I've been touching on, particularly trauma-informed approaches, managing uncertainty, dealing and calibrating with media, you know, managing all of that, introducing technology. If you are introducing technology to someone in your family, and perhaps they're of the older generation, my advice, and you'll see it on the film, be patient with them. Be patient with them when you're introducing technology, Zoom or FaceTime to somebody for the first time. Certainly the younger generations will be able to switch over very rapidly to that technology, but be patient with the older generation. I'm now going to spend just a few minutes. The good people at ARMS just asked me to spend a few minutes talking about working from home, and so lots of lived experience for each and every one of us, I'm sure, right now on the Zoom. Absolutely get out of your pajamas each morning. There's some great, by the way, there's some great comics around people working from home, little videos of people who forgot themselves working from home and having Zoom meetings. There's no shortage of good humour out there. But, you know, for myself, I'm up every morning early, exercise, shower, shave, dressed for work, coming out to what was my daughter's bedroom before she left home, now my office, and that's my office for the day. It's a dedicated workplace, and it's a very important place. It's the only room of its type in the household, so it is the only office that gets used for all of my work commitments. And at the end of the day, it's an office that I close. It's an end of the day, I close the door on the office. But making sure that you are really looked after. You're not, you know, decked out in a way that is right for you. You have the right equipment, natural lighting as much as you can, adjustable desk and chair. Now, many of these things you'll be familiar with, I'm sure, and there's each state and territory and globally, there'd be workplace advice and tips on working from home. Now, some people like schedule, and some people like discipline when they're working from home. And certainly, I spoke with a husband and wife team working from home, 2 separate rooms late last week. They always have lunch together. They always make a commitment, no meetings, no Zooms, no teleconferences at a certain time. They'll actually have lunch together, and they'll switch off. And from all of that, they'll go outside. So I spoke to a PhD student, might have been Monday of this week, and she told me what I'm doing every day for lunch is I'm eating my lunch outside. I'm not eating my lunch at my desk. So for some people, that's really good, and sticking to that schedule, sticking to that plan, and ensuring that they have plenty of breaks. So all those ergo assessments and advices are really super important. Disconnecting from work-related accounts at the end of the day, ways in which to end your working day, and my language around this is to close the door on your workspace at the end of the day. I think that's an incredibly important thing to do. And limiting distractions. So, there are real challenges here. I've got team members who are home with young children, and I've got team members who are sharing. I've got a team member at home right now who's sharing in a very small, tight living arrangement, and she actually has to work from her bedroom to be able to do that. So this is a really critical and hard time. We are not talking about a workforce that's a homogenous group by any way or shape. But importantly, keeping in touch and keeping in regular contact with your manager and colleagues, ensuring that you are each aware of your tasks, workloads and timelines. So I'm hearing lots of great stories of ways in which that's happening. So very briefly for my group, we have 2 big group meetings each week. So our research team at the University of South Australia, we have a big portfolio of work, in excess of $3 million annually as our current receipts on our work. So I've got a big portfolio of work, a lot of projects, a lot of PhD students in nursing and in other forms of mental health care, mental health nursing and other care areas. We're meeting twice a week, beginning of the week as a group, end of the week, and all of our PhD students we're talking to on a weekly basis. And then more if is required. And it's working really well. And to supplement all of that, we've set up a group chat account, a chat account through social media. And it's just for humor. It's just for funny things, photos of pets, little YouTube clips that are fun, safe, obviously good things to share. And every now and again, we might have something that pops up that we share something. So we've got this sort of work frame, if you like, of doing the business, getting the research done, getting the business done. But then we've got this other really lovely, a lovely chat happening where there's some little jokes and little commentaries that might pop up, 1 or 2 a day, that you can opt in and out of. There's no commitment either way. So keeping in touch is not just about work. Keeping in touch is about human connection. Keeping in touch is about what's right for you. And it's also very good for your thinking brain to be able to have a bit of relaxation and time together. Here's just a quick snap of some of my wonderful team. I've found a way of bringing them into this presentation, just having a chat with one of our PhD students about her work. And it's on that note that I'm going to draw my presentation to a close. I thank you very much for listening. I thank you for watching, and I really thank you for taking the time, if you've out of your day, to be able to think about these things, think about what this means, know how and when to move in new ways, to think about the backstory of how our life has changed, what it means for us as humans, how we're wired up, what we're programmed to do, what evolution has taught us to do, which is we love to embrace, we love to be with other people. And yet that's exactly what this virus exploits. It exploits what humans do best. It exploits it and it threatens us. It puts our lives in danger. And we need to think about how we can move as close as possible to living a flourishing life, despite all of these limitations, despite all of these really important limitations and mitigation actions by government and within our university system to prevent the spread of the virus and promote the well-being of each and every one of us. Our group does run an update, and we do share updates on our Twitter account We share updates on mental health and suicide prevention related matters, but we also share updates related to COVID-19 and ways in which I think credible information is available. We'll make that available. I guarantee you will not get any photos of lasagna or Caesar salad on the university Twitter account. You will get good, credible information. So please check us out, and we'd be very happy to connect with you. So thank you very much, everyone, and thank you for the opportunity, Ross and the team.
Thank you, Nicholas. That was, oh, hang on. See, this is here because somebody told me Microsoft Teams, even when you've got your camera off, if it's been recorded, you get seen. So hence I have this very high-tech solution to that particular problem when I've got my camera off. Nicholas, there's a few questions which have come up in the Q&A. I don't know, do you want to have a look through those and see if there's any that you can answer in the next couple of minutes, or would you like me to pick some out for you?
Yes, I'm happy to pick them out, Ross. I'm happy to be guided by you. That would be fine.
I think we've got time for a couple of them.
Okay.
First of all, there's a lot of praise for the subject matter, and I'll add mine to that. That was a really fabulous webinar, Nicholas. Great to hear you again talking about this. One question we have from an anonymous attendee is, do you have any tips for family members or friends in supporting someone who has been triggered by what they're experienced through this pandemic?
Yeah, that's a great question. And I think the tips that I have for someone who's triggered by this pandemic are tips that you should take on for yourself and what you can do in interaction with that person. So things that you can do is that triggering can be contagious for someone that we care and love. We care for and we love. And to be able to know what your triggers are, so what's going to activate you. Don't do anything alone. Work with other people. Work with people that the individual themselves is agreeable for you to work with. So co-design solutions. So if there is an opportunity for you to sit down with that person and have a good, honest conversation about what would be right for you when you feel that way, when you do that, when you say that, what is it that you need right now? What do you need people to say, do, think and feel right now that is going to help comfort you, distract you, maybe calm you? If we have that conversation now, and if we identify who else should be involved in ways that are going to distract you, comfort you and calm you, we can bring our best thinking to make your life and your situation easier and safer. And I would write that down. I would put that on a piece of paper and I would write that down. It doesn't need to be a formalized agreement or anything like that, but it's just an understanding in a quieter time about what is right for that person. And maybe the partner, the work colleague may not be the right person on all occasions. And that's where others can come into play.
Thank you for that. And just to let everybody know that this session has been recorded and a link will be made available to everybody probably next week, just as a number of people have expressed their desire to share this with friends and family, children who are in year 12 and having a particularly anxious and stressful time at the moment. One question from Michelle. There seems to be extremes of responses to COVID-19, from panic buying through to denial. And the question is, how important is it to continue to accept the swings and roundabouts of our emotions over what looks like being a long haul?
I think it's probably important to think of that in terms of a bandwidth. What's going to be a bandwidth for us as a family? What's going to be a bandwidth for us as an organisation? What's going to be a bandwidth for me as a person about what I think is acceptable within that bandwidth? And it's kind of like COVID-19, I'm going to use a blood pressure analogy here. It's kind of like COVID-19 has bumped up our blood pressure 10 or 15 degrees, if you like, percentage points collectively. So we've kind of got to try and accommodate that, but not be maxed out by it. Accommodate that and not put ourselves at risk. Accommodate that, but not put others at risk. Accommodate that and be able to put in place things that are going to be healthy options and healthy choices, you know, devices at night, eliminating that, shutting down at work, you know, at the end of the day. All of these things, calibrating your media exposure, all of these things taken in combination, you might then be able to adjust that bandwidth that you've set yourself and have discussions, have a family meeting. Look, I recommend if you're struggling with this as a family and you're trying to think about doing year 12, dad's working from home, have a family meeting and talk about that. Talk about maybe what are triggers for the year 12 student, what are triggers for dad, and what are triggers for mum, and how we can all be kinder and help each other in that process.
There's too many questions to go through them all, which is always the case, but I'm just going to pick one more, which is looking forward. And the question here again from an anonymous attendee is looking forward to when life returns to normal, whatever that was and whatever it will be, and framing it in the sense that some people who have had to self-isolate from returning from overseas have indicated that it's stressful going back into the world after that, and we're all going to be in that situation at some point in the next weeks or months. Do you have any advice around that, preparing for that snap back into reality?
Look, and it's not clear if it's going to be a V-curve snapback or a U-curve snapback. It's not clear how that's going to play, so U-curve or V-curve snapback. I think I will certainly be giving advice to our national government, but we've got to be really clear here not to stigmatise people who had the virus, not to stigmatise families and those people of loved ones who have been impacted by the virus. And we've got to move, I hope, to a more kinder and more understanding place for the lives of crises of people who have been impacted by this virus. And I think give yourself time to come back, transition slowly. Don't transition back overnight. Give yourself time, work with a plan, work with a health professional or mental health professional if you think that is easier. Calibrate your kind of re-entry, and for some people it might even be a rediscovery and reinvention of themselves after COVID-19. There might be some things that happened during COVID-19 that they want to take into the new era, the new epoch after COVID-19. But as a nationally, we've got to be very careful not to stigmatise people, shame people, target people across the lifespan, children as well.
That's a really good point. With apologies to everyone who's posed a question, we've not had time to get around to them. Perhaps we'll find a way to try and address some of those in a different format. Nicholas, on behalf of ARMS and everyone, I really want to thank you for taking the time to give this great presentation. The content was fabulous, and just in terms of looking at the numbers, this has been, I believe, the most highly attended webinar that ARMS has ever run. It's certainly breaking records in terms of the conversion rate from participants and also the retention rate or the stickiness of people who have stayed around. And I think that's testament to the topic, but also your delivery. So thank you for that. You mentioned that when in the moment, it's important to retain an active thinking brain and to balance that with information overload and to look for trustworthy information, people, and that reciprocal human connections are essential. So on that note, I'm going to take a cheap segue into advertising that the next PD at Zoom session by ARMS is on the 28th of April, hosted by the South Australian chapter on bibliometrics for research management and evaluation, presented by Adam Finch. So as a piece there of business as usual continuing whilst we're all also looking to grapple with how we can accommodate this. As I mentioned before, a YouTube link for this recording will be shared with everybody in the next week or so. I'd like to conclude, if I can, with just sort of pulling out some of my key takeaways from Nicholas's presentation. It's all about maintaining physical distancing. It's maintaining that physical and mental exercise, and it's about maintaining social connection. And that last one there is so difficult to do in these challenging times. And to also control the social media and other unhelpful consumptions, which can really get out of control in these sorts of situations. I want to emphasize, as Nicholas has done, ask for help if you need it, ask those around you if they're doing okay, and to focus on your well-being, because you and those around you can build on that particular foundation. So Nicholas, again, thank you very much for a fabulous presentation. Thank you all for attending this webinar. I hope that you share my views of the benefits that it has brought. Keep safe, follow the rules, keep well, and I hope that you all have a chance to relax over this long weekend. And at this point, Nicholas, I think there's applause and standing ovations, but you just can't hear it. But thank you again for your time.
Very welcome. Thank you for the opportunity. Thank you, everyone.